Hi everyone, this is me, Danny. I just want to let you guys know this is my video talking about a little bit about my experience about being a new grad. And I actually had my first day on my own as a registered nurse on the floor yesterday. So June 2nd is the date, and I have that marked on my calendar. And that's going to be my special date of, being a new nurse, working on my own with my own patients with no preceptor. So I feel very proud, and I was a little overwhelmed and emotional because it felt really good to accomplish that without having a preceptor around. I mean, there were still nurses at the other stations and my charge nurse that I could go to get help, but it just felt good that, my preceptor wasn't there to, like, pick up the slack. I was able to stay on top of things. I took care of all my patients, provided the care. I communicated with doctors. So it was kind of different because, like, on the board would be my preceptor's name, and then there would be my name next to it. And, people would ask for my preceptor, and I had to tell the people that were calling, I'm actually under orientation. I can take the report, or what was the order? Please tell me the order because I can take the order. So when I went into work yesterday, I saw my name my name by itself, Danielle Rodriguez, with my phone number and the patients that I had, and my preceptor's name was nowhere there. So I was like, "Yep, this is happening." My first day, everyone was excited for me, and everyone kept telling me, "You're gonna do great. It'll be fine." Inside, I was like, "I'm not sure," but I had my poker face, so I was like, thank you, I appreciate it. I got this." So I think with any new grad, I mean, there's gonna be some nerves, some excitement, maybe some doubt, because I feel like I don't think as a new grad, I don't think anyone really feels truly ready. Deep down, even if you're saying, "Oh yeah, I got this," I can totally do it. I think there's always a little bit of doubt, thinking, "Oh my God, I'm gonna be on my own. This is scary." But my shift yesterday, I did 13 hours, and I was able to complete almost all the tasks. There were some things I wasn't able to finish, like minor things, like, forgetting to bring some ice chips to a patient, or, you know, what else? Or bringing, like, gowns, like minimal things like that, or putting in an order for some grapes. So I just like minor things like that. So I wasn't able to do, like, all requests and do everything I could, but I did the main part. I prioritized, and I did the tasks that needed to be done for that day, for that shift, to provide the best care possible for the patients. So it was nice because I had to plan out my day. I had to organize my paperwork. I get report, um, going in, updating the boards. I know you nurses know about how we have to update our boards, so I had to do that. And I really feel fortunate about being on the floor that I am. I am a surgical nurse, and the team that I have, there's great communication, there's good teamwork. Everyone's willing to help each other out when there's time. When they have time, people are always willing to help each other out. And I have great charge nurses too, so they're also a great resource. So even though I was on my own, I mean, they were still there if I had any questions. Just that, now I have my own patients that I have to take care of, that I know about, and I don't have a second person that's behind me that also knows the patients to also take care of them too. So it was like a different kind of support system of not having my preceptor. But my preceptor, she was pretty awesome, and I also had a secondary preceptor, and he was awesome as well. They taught me a lot. They taught me how to, like, organize, critically think, how to perform skills, practice with dressing changes. So I learned a lot from both of them while I was on orientation, because with my program it's 3 months. So I began in March. In the first couple of weeks, I did 8-hour shifts, like Monday through Thursday, with having Friday classes. And then afterwards, well, with 8-hour classes, we had different preceptors. When we did the 12-hour shifts midway through the 3 months, then we had, at least for me, I had a primary and a secondary preceptor. So it was nice to have it consistent, and it was nice to have spend a lot of time with my primary preceptor because, we built like a bond slash trust. So she knew what I was strong and what I was weak at. So we were able to work on that. And my secondary preceptor, I already had a good bond with him because I did my senior focus at the hospital, and I worked with him, so he knew me well, and I knew him well. We trusted each other, so that worked out great as well. But I was with the the female preceptor more often because our schedules just matched up better than with my with the other preceptor. And I really like the advice she gave me for a new grad, saying that you only have 12 hours. So don't feel bad. Don't feel upset that you're not able to finish every single task that you want to do. She told me you only have 12 hours. Do the tasks that are most important and that have to be done for the day. If it's something minor, leave it for the night shift to do it. Night shift can take care of it. Remember that we are a team and we work together to provide the best care possible to all our patients. So don't feel like you have to carry the whole world on your shoulders. And that meant a lot, and I appreciated it a lot. Because as a new grad, I just feel like I want to do everything. I want to be able to provide the best care possible to all my patients and do everything I can on my part. But I do realize that I do need help. I do need to ask for help here and there sometimes. And the nursing assistants there, they are very awesome. They're very great on my floor. If I need something, they're there. They show me something on how to order stuff on the computer. They know how to do it. So having them as backup is great. While they can do simple tests like that for me, I can do the other tests that I have to do, like passing out medications, for example, and giving shots. So it's a new feeling being the actual nurse taking care of the patient now. Not having to say, "Oh, hi, I'm Danielle, I'm one of the new nurses. I'm gonna take care of you today," and Kim as well. That's my preceptor's name, Kim. So now it's like, "Hi, I'm Danielle, I'm gonna be your nurse today." So she's cut off. It's just me. I'm your nurse for the day. So, inside I was a little scared and anxious, but on the outside, when I have to talk and I have to put up a strong persona, I put on my poker face and I smile, and here I am. And I feel like doing that, it also gives me some kind of some confidence in myself, because it's I went to school, I got my bachelor's, I passed my NCLEX. I mean, I know what I'm doing if I'm able to do all of that. Now it's just actually applying and, building a rapport with the patients, communicating with doctors, having the full picture of it. Because with nursing school, you really don't get the full picture, especially because when you go to clinicals and work with nurses, it's their license on the line, so they have to be more cautious when they work with students, which I can understand. I can understand that now. So they let the nursing students do little tasks here and there, but we weren't allowed to do the charting or none of that. We were basically allowed to pass meds, give out shots, do assessments and whatnot, but not really document on the computer. So then when I actually became a nurse and did the new grad program and learned the full scope of it, I learned how to do charting, how to make rounds to with the doctors, building that rapport quickly with patients, and not being timid and scared when you go in the room for the first time saying, "Hi, my name is so and so." Sometimes I forgot my own name, and my preceptor had to come in and say what my name was, because I was I don't know, I forgot my name, oops. But that was in nursing school. As a new grad, I was I knew how to introduce myself. I have very good communication skills. I know how to communicate with people. And I do have a lot of compassion for my field. of nursing. So I know nursing is a good fit. I know I have to learn that I can't do it all. I can't put the world on my shoulders, because then I'm just gonna break down fast. So I have a good support system. I have great family support. I have great friends support. My colleagues, my coworkers that are also in the new grad program, great support as well, and as well as the people on my floor that I'm working with. So I'm very grateful for where I'm at. And as a new grad, just don't don't doubt yourself. Have confidence. And like I said, if you were able to get into nursing school, pass nursing school, and take the NCLEX, then you know your stuff. You do know. Now it's just you have to apply it. Go to the next level, critically think, use clinical judgment, and use that knowledge that you had and you've gained throughout your years in nursing school to apply it and use it in the actual work setting. So I feel like sometimes we forget that and still feel like we're not good enough, but you are good enough. And another thing is that also you will never feel ready to get off orientation and not have a preceptor. I knew when my day was coming, I'm like, I still don't feel ready. I don't think I can do this. And my preceptor was like, you've done everything you could. You're ready. I believe in you, and you are ready. So I was like, oh, I'm so nervous. But she texted me that morning and she told me, good luck. You're gonna do great on your first day, which made me feel good. And everyone else on my floor was telling me, oh, it's your first day on your own. Oh, you're gonna do fine. You're gonna do good. If you need anything, let us know. We're here to help you. So that meant a lot, and especially for my first day. So this week, I'm gonna have a couple of days, working a couple of days. So I'm really appreciating my days off now, after being tired, working 13-hour shifts on my own and not having like additional backup. But it's good and it's rewarding, and I can see with the patients, they appreciate it. I try my best to provide the best care that I can with a friendly face, and try to make them as comfortable as possible, because when you're in the hospital, I mean, you don't have no control. You can be in a lot of pain, especially when you have surgery too. So I mean, I try to make it as comfortable as possible on my part, but I know I can't please everybody, which I have been learning for the past couple of weeks. I really can't please everybody, even though I wish I can. So I say my advice as a new grad, have confidence in yourself, believe in yourself. Um, try not to have a bunch of self-doubt, because you've done it all. You know what you're doing. You just need to practice, and also just know you have your resources there. Use your resources, whatever they provide at your work setting. And that another advice is that you're never going to feel ready, but you need to go out there when they tell you you're ready to get off orientation. Believe in them, because they wouldn't let you go off orientation if they felt like you were not ready. So just keep that in mind, and get ready to spread out your wings and fly off out of the nest. And as a little hoorah for doing my first day on my own, I wanted to buy something new for myself. So I bought this. It's a Littmann Classic 3 stethoscope. It's called the Classic stethoscope. And my other one I've had since nursing school, so I felt like it was time to get an upgrade on it, which I felt like I was betraying it, but at the same time, like, I really need a new stethoscope. And also I want to celebrate by completing my first day on my own as a new nurse, as like a beginning of a new chapter. So it's actually pretty nice. So I just wanted to show my stethoscope. So here it is. It's royal blue, like my other one. I love royal blue. It's one of my favorite colors. And then it says right there, oops, Littmann quality. And I like it. I can hear lung sounds, heart sounds. I practiced on my parents today to see how it works. And actually when there's noise, I can still hear their heart sounds and their lung sounds, which is pretty cool. So this is like a very good stethoscope, and I got it on Amazon today, and it was like same day delivery. So I actually just got it like a couple of hours ago, so I'm really stoked to use this in the work setting. So yeah, I'm very happy. The next step is that I'm gonna want to buy some new shoes, because the shoes I have are not the greatest, and they hurt my feet for being on my feet for like 13 hours. I never sit unless I'm taking my 30-minute break or my 15-minute break. So yeah, so to all those new grads out there, keep doing what you're doing. You're doing great. If you have a compassion, if you have passion for the field, you show a lot of compassion to your patients, then you're gonna do well. Having compassion is very important, because anyone can develop the skills and anyone can pass out meds. But if you don't have compassion for what you're doing, then working and being a nurse and working in this field is probably not going to be the best for you. You're not going to be happy in it if you don't have that compassion first. So, good luck to all those new grads out there. Congrats to all those in nursing school, and doing your best out there. Best of luck to those that want to get into nursing school. And to our veteran nurses, you guys are awesome. Keep doing what you're doing out there. You guys do a lot too, and also you guys are nice, that those that precept us new nurses and provide guidance and wisdom of to help us become good nurses in the future, hopefully like you guys, and have that same experience as well. So thank you all for watching my video. I'm not sure when I'll do another nursing video again. Probably I may do an update like a month later, telling you how it's been a month later, being on my own. So, but I really want to do this video to show, not to show, but to talk about how my first day actually went. And I did have the excitement, the nerves and whatnot, but it went well, and I was able to do it. So I feel like once you overcome the first step, do your first day on your own, then you're gonna build up that confidence, and it's gonna come naturally, and then you're gonna start having your own routine and knowing what to do, get that clinical judgment, get that critical thinking going, and you're gonna become a great nurse. You will be a very good nurse, so don't doubt yourself. Just keep practicing, keep learning, ask for help. Don't isolate yourself. Ask for help and use your resources out there. So again, thanks everyone. You guys have a good night, good morning, good afternoon, wherever you guys are watching this video. You guys all take care now. Thank you so much. And thank you to all my friends and family for supporting me and being there for me throughout my nursing journey, and also my colleagues too that are also in the nursing residency program. I appreciate it. Thank you so much, and thank you, and I don't know what am I saying. Just thank you. Thanks. Bye.